COVID-19 variant, which has been identified in South Africa, has become a cause of concern for many countries. The new variant could possibly be worse than the Delta variant. Scientists say that this variant carries an extremely high number of mutations and could drive further waves of the disease. The new variant of COVID-19 has 32 mutations in the spike protein. Delta has 2 mutations, while Beta has 3. The World Health Organization convened experts in a meeting to assess the new variant.
It will take a few weeks for us to understand what impact this variant has. Researchers are working to understand more about the mutations and what they potentially mean for how transmissible or virulent this variant is, and how they may impact our diagnostics, therapeutics, and vaccines.
Cases of the new variant have been found in South Africa, Botswana and Hong Kong. The latest country to have reported a case of the new variant is Israel. One case of the variant, first detected in South Africa, has also been confirmed. The infected person returned from Malawi. In South Africa, the number of daily infections has increased tenfold since the start of the month. On Thursday, it recorded over 2,400 infections, nearly double the previous day's tally. The number of fatalities shot to 114 on Thursday, up from 22 the previous day. The European Union is mulling a ban on travel from South Africa following the discovery of the new variant. Scientists fear it could torpedo efforts to beat the pandemic. The United Kingdom has issued a travel ban from 6 southern African countries. On the list are South Africa, Namibia, Botswana, Zimbabwe, Lesotho and Eswatini. Officials at the UK Health Security Agency described this variant as the worst yet. South Africa has slammed Britain's decision, saying it's rushed.
What we will be doing is from midday tomorrow, we will be suspending all flights from 6 southern African countries, and we will adding those countries to the travel red list. Those countries are South Africa, Namibia, Lesotho, Eswatini, and Zimbabwe and Botswana. And we will be requiring anyone that arrives from those countries from 4 a.m. on Sunday to quarantine in hotels.
Germany has also announced a ban on most travel from South Africa. The new rules will be implemented from tonight and could affect South Africa's neighbouring countries as well. Only German nationals from these countries will be allowed to enter. And they must quarantine for 14 days, even if they've been vaccinated. Italy has also banned the entry of visitors from 5 African nations. Its government said that the country will follow the path of maximum caution. Austria, the Czech Republic and the Netherlands also announced travel bans from African countries. India has also issued an advisory in order to deal with the rapidly evolving situation. All international travellers from South Africa, Botswana and Hong Kong have been put in the at-risk category. All these travellers will be screened and tested for COVID-19. Their contacts will be tracked and tested. Australia is also investigating a new COVID variant as it spreads. The country has warned that it may close its borders to travellers from the African nations if risk from the new variant increases. Singapore, too, has restricted arrivals from 7 African countries. Well, for more on the European Union's approach, we can speak live to our correspondent Lucy Hoff, who's joining us from Brussels. Lucy, the latest news seems to be that it has spread to Europe as well, with cases detected in Belgium. What more do we know about that?
That's right, Nick. In the last few minutes, we have had confirmation from Belgian authorities that one case of the variant first detected in South Africa has been discovered in Belgium, with the country's top virologist, Mark van Ranst, warning that it is likely that the new variant is already present on the continent, albeit hasn't been properly detected yet. However, in a limited capacity, he did say. Now, in terms of this case, we understand it was someone who had recently travelled back into the country from abroad. We are expecting further checks to be carried out as part of Belgium's testing regime in the coming weeks, but clearly that will be of concern both to people here in Belgium and to neighbouring countries that variant is already present in this part of Northern Europe.
And Lucy, we've seen individual countries within the European Union begin to take steps to limit this new variant. Are we likely to see a concerted effort, a centralised response from the European Union itself?
Well, we do have a meeting this afternoon, Nick, of the Integrated Political Crisis Committee of the European Commission, which will see a meeting of EU 27 member state diplomats to discuss whether or not to trigger an emergency brake for a non-EU country where a worrying new variant has been found. So this could be an EU-wide change of policy when it comes to travel from Southern Africa, including South Africa and other neighbouring countries. Now, we will be expecting a confirmation of that in the coming hours, but meanwhile, as you mentioned earlier, there has been the announcement from several EU member states such as Germany, the Netherlands, Italy and France in imposing restrictions on travel from Southern Africa. Germany, for example, will say that only German citizens can travel back into Germany, and anyone, including those fully vaccinated, will need to quarantine for 14 days. Other countries such as Italy going a step further and suspending all travel from that region of Africa. Other countries such as Austria and France introducing similar restrictions. But as I say, we could soon see an EU-wide blanket policy introduced in the coming hours. Now, Mark van Ranst of Belgium is saying that whilst a travel ban may be affecting reducing case numbers, it won't limit the spread completely, given particularly as he has warned that there are likely to be limited numbers of cases already here. But really, European scientists saying that this is the most significant variant of COVID-19 discovered so far, so countries taking drastic measures to stop the spread here.
Lucy, thank you very much. That was Lucy Hoff joining us live from Brussels.